Dr. Pyle Coley is with us this morning to talk about holiday heart syndrome.
Yeah, so let's start with the basics, Dr. Coley. First of all, good morning. What is holiday heart and who does this usually affect?
Yeah, so actually the researchers coined this term because they realized that in December, there's a high rate of arrhythmias or electrical disturbances that happen. Now, the most common arrhythmia that you're going to have is something called AFib or atrial fibrillation, but you can also have other types of arrhythmias like PVCs. That's like a flip-flop in the heart that you can experience, or just extra skips or extra beats, and it happens during the holidays just because of some of the behaviors that we indulge in.
This month is just so stressful for a lot of people, right? On top of it, you're eating all the wrong things, drinking way too much, right? I have felt it already in December, you know, like your chest is really tight. When do you know that it's something a little bit more, that you should probably seek attention for it?
Yeah, I mean, you hit on all the points, Corey. So too much alcohol, too much sugar, too many calories, too much stress, lack of sleep, and even the cold weather can actually trigger all of this. And what you would feel essentially is a fluttering in your chest. A lot of people feel palpitations, they feel short of breath, they can feel lightheaded or dizzy. You can have chest heaviness or chest discomfort. Usually this happens to people who otherwise have a healthy heart. So it can be extremely scary. And I would say if you do have this kind of a sensation, depending on which arrhythmia it is, it could potentially be dangerous because some of them can increase your risk of stroke. So it's important to go seek medical attention right away if you feel something fluttering. Your heart can be racing too. So it's really important to go quickly. Don't put it off and say, oh, I think I'll feel better tomorrow.
Well, explain that threshold to me, because I could absolutely see me doing something like that. You know, is this going to be something that is very noticeable, that you're like, that is not normal, that is incredibly weird? Or is it kind of on the slight end of things and I'm just dismissing it?
Yeah, so great question. So really it depends on which arrhythmia you get. If it's that flip-flop in your chest, think about it when somebody startles you, your heart kind of skips for a second, right? That's called a PVC, premature ventricular contraction. So that kind of comes and goes throughout the day. So that may be like, oh, I just felt a little something. Whereas AFib is the heart racing and irregular. For most people, that's not something you're going to miss. You're going to feel it. You're going to feel like the wind's been knocked out of you. You won't be able to walk up the stairs without getting short of breath. And like I said, if you have dizziness or chest heaviness, then it's time to seek urgent attention right away. Regardless, what I really advise is people blow off symptoms during the holidays. In fact, we have the highest risk of fatal heart attacks during Christmas. And that's because people minimize symptoms. They don't want to disrupt their family. But if you're feeling something, say something.
It's really interesting that you said, you know, this is usually for people that don't have any heart problems.
Right.
Who is the highest at risk here?
Yep, so it can happen to any of us, which is why we all need to be really mindful of our eating, drinking, and sleeping habits over the holidays. But clearly those with underlying heart disease are higher risk. Anyone over the age of 50 is higher risk. People who drink a lot of alcohol at baseline, surprisingly enough, can also be higher risk because their heart's sort of already sensitized to that alcohol. And then anyone else who might have high blood pressure, diabetes, chronic medical problems, all of these individuals are higher risk. If you have anything structurally wrong with your heart, I have patients in my practice, and I see holiday heart every single year, who might have a leaky heart valve or something that we've been watching for a while. That really sets you up to have this arrhythmia as well.
All right, real fast, because we are out of time. How do we prevent this?
Do all the right things. So make sure, yes.
That's asking a lot of us.
I know, but just not too many sugary cocktails, not too much stress. Try if you're not going to sleep, make sure it's not more than one night in a row, you know, so just make sure you have a recovery night. And then electrolytes are really, really helpful. So if you are going to drink, I say drink a little electrolyte solution before bed or when you wake up in the morning to really help balance that out.
Well, if this does happen to me, I blame Corey. I blame Corey.
I'll give you electrolyte drinks tonight when you guys leave.
Yeah, she got the hot honey margarita ready. I'm picking up the pizza for her from Big Bill's on the way. Big Bill's, I'm coming for you.
Well, maybe just add the electrolyte thing to your pizza or to your drink.
To my pizza.
We'll get a side salad.
Okay. Yeah, perfect. All right, Dr.
Call me if you have holiday heart.
I'm putting you on speed dial. Dr. Coley, thank you very much.